Hi, my name is Henry Babichenko. I'm the owner of a Stomadent Dental Laboratory, and today we're going to look into the All-on-4 clip-on bridges or All-on-4 removable bridges. What is the All-on-4 clip-on bridge? It's the alternative for All-on-4 screwed-in bridge. Right here is the All-on-4 screwed-in bridge actually, but maybe a provider decide that's not an option for the patient. So then they can actually use the All-on-4 clip-on bridge. It's very similar, but patient can remove and clean whenever they want it. Well, if you're gonna think that a screwed-in bridge will be a problem for patient to clean it well, then that's when you're gonna choose the All-on-4 clip-on bridge, because patient can actually remove it very easily. They can brush around the implants or abutments, and also they can easily clean this All-on-4 clip-on bridge. So that's reason number one. It's for the hygiene reason. Reason number two, if you are not sure the strength of a implant post in a patient bone, then that's when you're gonna choose the All-on-4 clip-on bridge. All-on-4 clip-on bridge actually have this mechanism called the locator housings, and locator housings inside have a nylon insertion. A nylon insertion is a mechanism that simulates the shock or serve as a shock absorbing mechanism and simulates the movement of a natural tooth, or I would say simulate a natural periodontal fibers, and therefore will exert less pressure on the implant post. And the third reason when you're gonna choose the All-on-4 clip-on bridge, it's of course for the cost reasons. The All-on-4 clip-on bridge will cost less, I would say about twice less to a patient, and if the cost is an issue, that's when you're gonna choose All-on-4 clip-on bridge. And a fourth reason is the aesthetics. When patients have a high smile lip and all of a sudden you cannot remove enough of a patient tissue, and when patient smiles you can see that transition line, then that's when you're gonna choose All-on-4 clip-on bridge, because on All-on-4 clip-on bridge we actually can go ahead and overlap the smile line or transitional line as much as we want it, and therefore hide it, so when patient smiles we can see that we cannot see that transitional line. Number one, it's maintenance. Much easier for patient to maintain that type of restoration. They can remove it anytime, they can actually clean it very easily. And then if we need to change the nylon clips, patient came to the office, we can just replace those nylon clips approximately in 10-15 minutes. So very easy to maintain that type of a restoration. The other reason why, or the advantage, is actually the repairability. If something fails and we need to repair that type of restoration, or maybe a patient lost one implant, when it comes to the screwed-in All-on-4 restoration, then it's pretty much the whole bridge fails. But the clip-on, if patient lost one implant, and while we placing that post, or maybe we even cannot place the fourth post, then we can easily modify that type of restoration to fit over the 3 implants, or later if you would add one more implant, then you can modify that type of restoration and engage into the 4th new post. Then the third point, it's the workflow for the clip-on bridges. Workflow, it's how do I start on making the clip-on All-on-4 bridge? Well, patient came to you and let's say you already placed the locator abutments. Then when taking an impression or workflow for the traditional impressions, what you want to do, you want to take a housing, a locator housing, you want to place into the abutment in the patient mouth, and you would place all 4, or if there is more than 4, like in this case there is 5 abutments, you place locator housings onto the abutments, and you just take a stock tray and you take a pickup impression. A pickup impression actually doesn't have to extend all the way, because the bridge will be where we just placing right on top of a patient upper jawline, so we don't have to have all the extension in vestibule. So you just take a stock impression, do the pickup impression. A lot of times some of those housings will be still left on the abutments. You just remove them, place back into the impression. And the next step, a lab will provide you the bite rims, and then you would use a regular bite rims to take the VOD and smile line, then the size of a teeth and midline and all those necessary stuff. Then for third appointment, a lab will make you a bar with the housings is being part of the bar. So at that appointment, you can go ahead and you can try this bar into the patient mouth, make sure that everything fits well, and then you will have a trying that you will place over the bar, and you're gonna try, make sure the trying and the bar fits well in a patient mouth. And if you need to do any kind necessary adjustments to the trying, or you need to retake a bite, that's when you're gonna do that. If you received a trying and you see that bite is off, then you do wanna grind the posterior teeth at least 2 millimeters down, because if you don't grind the posterior teeth and you just take a blue mousse bite, what you're doing, you just opening patient vertically. So it's very important to grind some of those cusps down at least 2 to 3 millimeters, and then you retake a bite, and then we can go ahead in the lab and pretty much adjust that new bite and provide you either another trying or go into the process and finish. Let's talk about workflow for the digital impression. Let's say if you decide you don't like to do the traditional impression, or you're already very good with digital impression, then on digital impression, what the lab will need is that you will take first digital impression with an abutments only. Then when you took that digital impression with an abutments, you will take another impression with a housing. So you again will place the housings onto the abutments, and then you will take another impression with the housings in. Why it's important to have a second impression with the housings? For a lab to create you a bar with the housings, we need housings in and then another impression without the housings, so we can go ahead and process that bar into the either acrylic or zirconia or any other type of restoration. And after that, the other steps will be very similar. If it's gonna be either digital or traditional impression, you will receive the bite rims to establish the vertical dimension. Then on the third appointment, if it's going to be a traditional denture over the bar, you will actually have a wax trying. If it's going to be a digital restoration, then it's going to be that white trying that you will do the trying with a bar. And the fourth step, it's process and finish. What kind of options of materials do we have for that all-on-4 clip-on or removable bridges? Well, option number one is that you will have a traditional denture acrylic. A traditional denture acrylic wraparound will just look like this, like, well, regular PMMA and a regular acrylic teeth or a composite teeth. Then the second option is going to be a milled PMMA or an iVotion. I would say that when it comes to the all-on-4 clip-on bridge, iVotion actually will be stronger than the regular PMMA, because iVotion is milled from the pink acrylic and the tooth in monolithic block. So when you mill that type of restoration over the metal bar, this restoration will be very strong. And the third option you will have over the metal bar is the zirconia, full zirconia bridge. So you would use a full zirconia bridge and just wrap around over the metal bar with the housings. I would say probably zirconia, full zirconia over the metal bar will be the strongest and probably the most aesthetic restoration. Then the second strongest option will be a monolithic iVotion restoration over the metal bar. And then the third is the regular acrylic traditional restoration over the metal bar. Then some offices will choose the restoration without the metal bar. If you choose it without metal bar, pretty much same options. You will have just locator housings in a patient restoration. So you can, same thing, choose the traditional. You can choose iVotion. iVotion will be a little bit stronger than the traditional, or you can go ahead and choose the zirconia with just a locator housing. This is the all-on-4 clip-on bridge, a removable bridge. Thank you again, and we'll see you later.